So good evening to our clinical instructor. I am John Tomas from BSN 3-2 and I'll be performing the recorded return demonstration for the fine motor test for upper extremities. So for the purpose of this assessment, this is to examine the cerebellar function and also the proprioception. And then also, we have to do the assessment, which is we have to inquire if the client have history of pain on the upper extremities, as well as the onset of aggravating and elevating factors, as well as the history of paralysis, tremors, tics, or such. So, meron po bang tingling or numbness, pamamanhid?
Wala po.
May tremors po ba? May tremors po ba or nanginginig?
Wala po.
Paralysis po or namamanhid?
Wala po.
Or hindi po magalaw? Nag-gym po?
Hindi po.
Activities po may ginagawa?
Wala po.
Nag-exercise po or nagbubuhat ng mabibigat?
Hindi po.
So for the planning, we have to prepare the client. So as you can see, the client is well-groomed. And also, you have to prepare materials to be used, which is the chair. So for the procedure itself, is that, we have to, first is for the planning. So for the planning is that we have to, right after that, we have to proceed on the procedure. So for the procedure, I have to explain to the client what we're going to do, why is it necessary, and how the client will cooperate on the procedure. As well as we have to discuss the client how the results will be used on the assessment. So, good evening po, sir. Ako po si John Tomas, student nurse po ako sa Wesleyan. Magiging nurse niyo po ako from 2 p.m. ng hapon hanggang 10 p.m. ng gabi. So, ang gagawin po natin ngayon is yung tinatawag po natin na fine motor movements po. So, matatest po nito yung upper extremities po natin, as well as matatest din po kung may madadetect din po kung may abnormalities sa brain natin. So, don't worry po kung may abnormalities naman po, mape-prevent po natin yon, and madadetect din po natin agad from becoming worse, and then report po natin sa physician. So, don't worry, anything that will be conducted within this assessment will be fully confidential within me and the attending physician that I'll be referring to po. So, right after that, we have to provide client's privacy, assuming that I just close the curtain rods and also close the doors. And then right after that, we have to do the procedure. For the first one, that is the finger to nose test. So we have to ask the client to abduct and extend arms just like this, and to the finger at to touch the nose of the client alternately at an ever increasing rate. So ang gagawin niyo po is itatouch nyo lang po yung nose niyo po ng ganito, tapos iaano po niyo yung arm nyo like that po. So, ganun. Tapos mabilis din po. Sige po, gawin niyo po. Sige po. Mabilis pa po. So, the next thing that we should be doing is have the client to repeat the procedure if the client, or if you assess that the client done this easily, so with eyes closed. So, ngayon po, gagawin niyo po yung ginawa niyo kanina, pero nakapikit po. Sige po, mabilis po. Bilisan niyo pa po. Okay na po. So, after that, we have the alternating supination and pronation of hands and knees. So, yeah, in this assessment, we have to ask the client if the client can tap his knees with the back of the hands as well as the palms alternately at a rapid increasing rate, and so ang gagawin po natin is itatap po natin yung dito po natin yung tuhod po, and then igaganon po natin alternately, tapos mabilis po. Gagawin nyo nga po. Mabilis pa po. Okay po. And then right after that, we have to proceed on the finger to nose and to the nurse's index finger. So So, we have, in this assessment, we have to ask the client if the client can touch his nose as well as my index finger at 45 centimeter distance at an ever-increasing rate. So, itap nyo po yung, gagawin nyo po yung, gagawin nyo po, itatap, or itatouch nyo po yung nose nyo, tapos itatouch nyo po yung, daliri ko po. So, sige nga po, gawin nyo po. Mabilis din po. Bilisan nyo po po. Sa kabilang kamay naman. Okay, so thank you po. So, right after that is we have to do the finger to finger. So, in this assessment, we have to ask the client if the client can extend or abduct just like the step number 1. But this time, the finger to finger, we have to put the client or put our arms together at the shoulder level, and the hands should meet or finger to finger should meet at the midline and alternately at a rapid increasing rate. So, ang gagawin nyo po is ganito po, tapos ganyan po. So, the first one is that we should be slowly to fast with eyes open, and then the second one, slowly to fast with eyes closed. So, una po is ganito, nakabukas po yung mata nyo, tapos mabagal po muna, tapos papabilis. Tapos, sa pangalawa po, una po, naka-close po, mabagal, then papabilis. So, gawin nyo po muna yung nakabukas yung mata. So, pababilis po. So, yung ngayon po is yung nakapikit na po, mabagal po hanggang papabilis. Sige po. Okay na po yun. And then, the last thing is the finger to thumb test. So, for this assessment, you have to ask the client if the client can touch his each finger to the thumb alternately with the same hand as well as on the other side or the other hand. So, ang gagawin niyo po dito is finger to thumb po. Ito po. Yan po. Dapat mabilis din po. So, gawin nyo nga po sa unang kamay lang. Ayan po, sa second one naman po. Okay na po. So, after that, we have to secure client's comfort and safety, as well as we have to document all the findings. For the evaluation, we have 3 things to remember. We have to accurately assess the client's movement during the assessment, and then identify any variations, and then report any deviations from normal to the physician. So, yun lang po. Thank you po.